Hi, my name is Deirdre Hughes. I'm an occupational therapist and certified hand therapist. Today I will be talking about PIP flexion contractures. The PIP joint is short for proximal interphalangeal joint and it is the middle joint on the finger. It plays a very important role in grasping and it accounts for 85% of our power grip. What is a flexion contracture? A flexion contracture is when the finger is stuck in a bent position and you're unable to actively or passively extend it. Depending on how severe the contracture is, it may interfere with your simple daily activities. Just trying to grasp for a cup, or trying to straighten the finger doing a weight-bearing exercise, or even just trying to reach back into the pocket to take out some coins will prove difficult. What causes PIP flexion contractures? It can result from trauma or from disease. So for instance, fractures, dislocations, sprains, and diseases, Dupuytren's, and arthritis. PIP flexion contractures are common injuries in athletes, especially those that play contact sports like basketball, football, or soccer. And many times they go unnoticed and untreated. So if you notice that there's a slight flexion pattern in the finger, please see your hand therapist right away because early intervention is the key to regaining your function. Now, how do we treat flexion contractures? If it is a very mild contracture, it can be treated with exercises and with a splint at night to maybe control the extension. If it's a more moderate contracture, you may need something like an LMB splint. So it has 3 points of pressure. So here, and just below the PIP joint. And this will gradually help to extend the PIP joint to regain your function. If it is a very severe contracture, you would need to see a hand therapist and they will actually help you to get a serial cast. And this is a cast that will be changed every 2 to 3 days until you regain your maximal range of motion. Another treatment could be an orthosis, such as a static progressive splint, which works under a low load, prolonged stress, and it helps to gradually improve your range of motion. Now I'm going to show some of the exercises that may help you to regain your function. So the first one, you're going to go ahead and bend the knuckles to about a 90-degree angle and take your opposite hand, press on the knuckles, go ahead and bend forward, and then you're going to extend and hold at your end range for about 10 seconds. And continue doing this. And you can increase the length of time that you hold the stretch for as you have less pain and discomfort. Another exercise you may do is to passively flex and extend the finger, the joint, to the end range, and then holding it at the end range again for another 10-15 seconds. And also go ahead and move the other joints because they tend to get stiff as well. So the key takeaway point here is early intervention. That's the key, is early intervention. So as soon as you see that PIP flexion contracture developing, try to find a certified hand therapist and they'll guide you in the best possible treatment depending on your severity of your contracture. I hope that this was helpful, and if you have any questions, please feel free to contact me by email, and thanks again for watching.